There's been speculation that the coronavirus was unleashed on the world after it escaped from a biological weapons lab in Wuhan, China. Other theories say that it originated in a wet market from Chinese people eating pangolin, a type of anteater, or from eating bats, or from humans eating pangolin, which had eaten bats. Regardless of which of the three proves to be right, it is undisputed fact that the coronavirus started in Wuhan, China. And had the Chinese government acted earlier to inform the WHO, CDC, and even local health authorities, countless lives could have been saved. Instead, researchers have pieced together a long trail of deceit and cover-ups which allowed the virus to not only ravage China, but to be transported to other countries, causing a global pandemic. On December 27th, when the first lab in China identified the coronavirus, which they described to be similar to SARS, the top medical authorities ordered them to destroy their research and samples, swearing them to secrecy. Additionally, when a Beijing health team was visiting on January 8th, Wuhan officials failed to inform them that local medical staff had already been infected by patients in an attempt to hide the fact that the virus could be passed through human-to-human contact. In order to perpetuate this lie, city health officials also failed to cancel a Chinese New Year celebration dinner, which attracted 40,000 guests, many of whom later tested positive for coronavirus. As people began falling ill and dying, brave Samaritans attempted to get the word out to the public, but they were silenced by China's internal security forces. The most famous whistleblower was Dr. Li Wenliang, who was arrested after posting warnings on Chinese social media. He was later released, but his posts were removed, allowing the disease to remain a secret that much longer. On February 6th, he died of coronavirus and became a national hero and a symbol of Beijing's censorship. Other critics of the regime who have gone missing include legal scholar Xu Zhiyong, a prominent civil rights activist who's been arrested numerous times in the past. His most recent arrest was on February 15th, after writing an open letter in which he called Xi Jinping clueless and asked for him to step down. A citizen journalist, Chen Chuxi, filmed the situation in hospitals in Wuhan and then disappeared. Deutsche Welle obtained footage of another citizen journalist named Fang Bin, who filmed body bags and the desperate conditions in hospitals in Wuhan. He was filming on a daily basis until footage appeared of the police breaking down his door. Yet another citizen journalist in Wuhan, Li Zihua, made a live stream video in which he was driving his car claiming that state security forces were chasing him. In the video, he made it back to his apartment where he filmed another video saying that he didn't want to be silent and he was hoping other young people would stand up like him. The video ended when two plainclothes police officers entered his apartment. The video was posted on Weibo, Chinese social media, but was removed by the authorities. It was also uploaded on YouTube. Dr. Ai Fun, director of Wuhan Central Hospital's emergency department, shared a diagnostic report with colleagues on WeChat on December 30th because she was concerned about a SARS-like virus which had been discovered in patients. She was criticized by a hospital supervisor for spreading rumors and forbidden from speaking about the virus. Hospital staff observed person-to-person transmission long before this was officially acknowledged or reported. Consequently, hundreds of doctors and nurses were attempting to treat patients without knowing about the epidemic. Wuhan officials told medical staff not to reveal that coronavirus could be transmitted through human-to-human contact. Hundreds of doctors didn't know, and when they became infected, they were forbidden from telling anyone, including their colleagues. Law enforcement officials told Wuhan Central Hospital medical staff on January 12 that coronavirus infectious disease forms could only be completed and submitted with guidance from experts at the city and provincial level. On January 13, Wang Wenyong, head of infectious disease control at Wuhan Jianghan District Disease Control Center, told Wuhan Central Hospital to alter a suspected coronavirus report to say that patients were suffering from other illnesses. Officials removed iPhone's coronavirus report from the People's WeChat page. Racing against the censors, Chinese netizens reposted the story, but it was found by censors and removed again in an act of defiance against government control of information. Netizens began reposting the story, translated into Martian language, an internet language used by people in China to sneak past the AI used by the censors. The story was written backwards, with many of the modern Chinese characters replaced with ancient characters, emojis, and braille symbols. 60 Minutes Australia reported that Dr. iPhone had gone missing, while countless Wu Mao accounts on Twitter are claiming that she is alive and well and still working in Wuhan Central Hospital. The fact that this cannot be verified underscores the problem of Chinese censorship. Hu Jia, a prominent Chinese activist, told The Independent, "Many people have been detained for speaking up about the truth, and I am expecting that something similar will happen to me." Hu was detained by police to prevent him from doing a Radio Free Asia interview related to coronavirus, after which he was put on 16 days house arrest. Once the virus was made public and mass lockdown and quarantine started, the government made it clear that it was illegal to post any information about the virus other than official announcements. Only the CCP determined how infections would be diagnosed and counted, but they changed the system twice, vastly altering the official numbers. CCP were the only ones allowed to count the infections and deaths, and the only ones allowed to report them, making a cover-up very easy to perpetrate. Government censors were scouring WeChat, Weibo, and other Chinese social media, removing content and threatening or punishing those who posted it. Normally in China, Twitter, YouTube, Facebook, WhatsApp, and most foreign blogging sites and news sources such as the New York Times are blocked, but most foreigners and many Chinese use VPNs to bypass the Great Firewall of China and access information other than the official narrative, or to post information and get word out to the outside world. But during the coronavirus crackdown, in some cities, VPNs didn't work at all. In others, they were severely limited. With coronavirus, China government was facing a PR nightmare. Many in the West assumed China was downplaying and manipulating the numbers in order to hide the real infections and death count. In February, Taiwan News reported that hospitals in Wuhan were refusing to administer coronavirus tests in order to keep the numbers of infections down. This was around the same time that Xi Jinping was beginning to encourage people to get back to work in order to save the economy. Beijing claims that over 50,000 people were infected with coronavirus and over 2,500 died in Wuhan. As many China experts do not trust the official numbers, we have been looking for some other proxy measure that would give us a clue as to how many people actually died. During the outbreak, the bodies of the victims were cremated quickly. There was all sorts of speculation about how many cremations could be done per day and how many crematoriums were working, but no one had enough solid data to really prove that deaths exceeded the official number. In March, China mobile carriers released their subscribers numbers, and it was determined that they had dropped by 21 million. This seems strange. Why would 21 million people suddenly cancel their cell phone service, particularly when they were stuck in their homes and couldn't go out? Those looking for evidence that China lied about the coronavirus deaths said that this was proof that the cell service had been canceled because those people were dead. But 21 million sounds much too high of an estimate. Bits of evidence have been trickling in from numerous sources which suggest, but do not prove, that China is lying. RTHK News Hong Kong reported on March 23 that hospitals in Wuhan had stopped administering coronavirus tests to maintain the illusion that the outbreak had ended. Other media, and particularly social media whose authenticity cannot be verified, were reporting that some patients who had been declared recovered had relapsed, or that new infections were popping up, but the hospitals were refusing to treat them in order to maintain the appearance that China had defeated the virus.